שלום לכולם, אנחנו בעוד פודקאסט שעוסק בענייני לימודי רפואה בחול. והיום נמצאת איתנו סיליה טיקי, או should I say דוקטור סיליה טיקי. Good evening, סיליה.
Hello.
Hi, so you are a fresh graduate 2 weeks ago from the medical faculty in Ostrava.
Yes.
How is the feeling to be a fresh doctor from the nylon?
To be excited, I'm still very excited. It's still very new for me, but it's a very good feeling.
Yeah, I can imagine it. And tell us a little bit about yourself. You are from Cyprus?
Yes, I am from Cyprus, from the north part. But I basically live here in Ostrava for 6 years.
Mm-hmm. Nice. So let's rewind. So tell me, please, what made you choose Ostrava from all of the places to study medicine, especially that we know that there are many options in Europe and many of them are more well known than Ostrava?
For me, to be honest, it was a little bit random choice as well, because when I decided that I want to study medicine, I just decided that I want to study in Czech Republic because of Czech Republic's reputation, how good they are in science and medicine. So I checked my options. Ostrava was in the options and I got accepted. So I came to the city and saw the city. I liked it. It's a very calm city. So I said, yeah, this is a good city. I can study here. And I continue to study here and I finished it.
Something maybe that surprised you the most when you just arrived to Ostrava as a city student, as a city?
At first of all, when I first came here, I think language barrier was a surprise for me instead of a city, because less people were speaking English, but now more people are speaking English. But Ostrava is much colder than the other cities in winter. So that surprised me a lot when winter came. I was really shocked because I'm a Cypriot, so I was not prepared for any cold weather.
Yeah, it's in the northern part of the Czech Republic, so it's a bit colder than the southern part. Any specific moment during the studies that you felt, okay, I made my right decision to come to study in Ostrava?
I think at the end of the third year, because in first year it's mostly preclinical subjects. So I was not actually feeling that you are part of in the medicine. You are not very involved in patient because there are many preclinical. But
Yeah.
after third year, when we start interactions with our patients and when the education and the classes got a lot better, because we are not very big group of students, so you definitely have chance to get in contact with the patients, and we have to do internships, hands-on training in the summer. So after third year, I said, yes, this is a good choice. I have options here. I made the right choice.
And where did you do the summer duties in the first years?
In first years, we don't have summer duties, but after third year, we have to do three or four summer internships: nursing, gynecology, pediatrics, and surgery. The first one was the nursing. That was the first time that we actually did hands-on experience, and we always had chances to learn on models and everything. But during nursing, we had to try like catheter thing, blood taking, blood sampling, injections, and I did it here in Faculty Hospital in Ostrava.
I've been in this hospital. It's a very big hospital, actually.
Yeah,
The
that was
central
also,
hospital of the area.
yeah, it's the biggest in this area. So it's very specialized in many things. Like I think it's specialized hospital for high risk pregnancy, stroke center, and traumatology. So they are very they have very huge capacity and good specialization and technologies in the departments.
Have you been in other hospitals in Europe or at home?
I did some internships back in Cyprus. I think one in emergency departments and pediatrics. I did some of my internships there because we have options to choose. But to be honest, I still prefer doing internships in Czech Republic because of
And
better technologies in our hospital.
and in retrospective, how do you feel that the preparation and the education that you got at the faculty and the most of it at the or the hospital, how did it prepare you to the clinical life?
I think it's really personal experience because when we are with patients, it depends if the patient has approval of students being there. So it can change to student, and but if any professor, if they see that you are ambitious and you are trying to learn and you want to try something, they will let you to do more things. I was lucky because many patients allowed me to be there. They just allowed me, so I saw I can observe many things. But I was also interested in neurosurgery, so I did internships in hospital, and they know my interest, so they were letting me to assist in surgeries as well. So it really depends on person to person, and if you really show that you're really interested to learn, they will give you more chances to try something, to do stitches, remove stitches, do some bandage and anything. So
I see.
I think it's good, like especially when the clinical part starts. It's really good since we have now simulation center. It's also involved in our curriculum. So we also now new students will have more and more options to do in simulation center as well. And in that center we have all like chances to try all the machines and practice on everything in different subjects as gynecology, ophthalmology. So they can prepare, like you can be prepared both on models, but you are also, if you show your interest, you have chances to try in person as well.
I would just like to emphasize to our listeners that the simulation center in Ostrava is one of the best in the Czech Republic.
Yeah, it's
It's
quite new.
quite impressive. Um, did you feel like that your professors knew you personally? They knew you by name, who you are, where you are from, and if so, did it make any difference?
I think half to half. Many professors knew us well because some professors teach us more than 1 year. Because some subjects are divided into multiple times, like surgery 1, 2, 3, and so on.
Mhm.
So if they were seeing us more and more, they were definitely knowing who we were. And especially, as I said, I did more internships voluntarily as well. They were all knowing me, not just professors, but nurses as well, the hygienists working in the OR as well. I was aware that they know me. And especially after, if you have personal connection with them, it just gets more easier and easier because they know who you are, you know who they are. So it's easier to connect with them as well. Like I know that after some time, I didn't even have to tell my glove size in OR because they already knew my size.
Uh-huh. Okay, so you're a part of a group of international students at the faculty.
Yeah.
Try to describe us what is a so-called normal day, how it looks like in a normal year in the faculty.
So if we are talking in the first 3 years, it's mostly theoretical lectures as well. So probably I was waking up, going to lecture. In the breaks, I was like having lunch with my friends or having coffee. And then after lecture, I was either like having rest or studying directly and then have rest. So I like going libraries to study, or there were some cafes that are very nice and they're usually student friendly. So I
Where
was
in
either,
the city?
yeah, in the city.
Mhm.
Like there
Mhm.
were a few cafes that I was going very often, or the libraries of the faculty. I like studying there. And then, well, if I don't have a lot of things to study or something else, I was usually doing something with my friends, maybe some squash, sports, walking with them, or maybe just meeting with them to go somewhere. But
And
medicine is a lot of studying.
a lot, yeah.
So, yeah.
Did you feel that you have that you had a support system, like from students, friends, teachers, the faculty, something
Um,
that helped you, especially in the first years?
First years we had pandemic, so it was very different for us compared to new
Yeah,
students because now my experience and their experience are completely different because we were not even here. So I cannot exactly say how was the first years because I don't even remember how to describe. We were back home, struggling with what is happening in the world. So it was different. But after when we came here and when we have like regular lectures, my friend and classmates, you basically become a family after some time because you are sharing the same struggles, like you are on the same boat. So we were always supporting each other, sharing our notes, helping each other to pass, and so on. And especially now, Ostrava, and I'm one of the co-founders of it. Now they're gonna have student organization specifically to international students as well. So now we are trying to aiming to build a lot better community for new students so they can integrate into the culture much faster. And we also try to bridge the Czech students and international students as well. So I think my experience was not it's not going to be valid with the new upcoming
I
students.
understand. Um, you come from a Mediterranean mentality, like similar
Yeah.
to Israel, actually. Um, did you have any cultural barriers with the Czech mentality, or was it
I think
easygoing?
in first years, yes, I definitely had some struggles because first year everything felt not familiar at all because of the language barrier and everything was a little bit difficult. But when the years pass, you also like learn the language, you learn the culture, you learn the daily living. So it becomes not a daily struggle to you, it just becomes your normal part of your life as well. But although I came from Mediterranean region, I like Czech mentality a lot because I'm very like disciplined people. I like to be very on time and so on. So I like Czech discipline as well.
Yes, they are very organized. The Czechs
Very,
in general, they're very organized. You know what they expect.
yeah, very
What
on
you should
time.
be on time.
Yeah,
We
yeah.
call them here Germans with sense of humor. They have
I
great
think
sense of humor.
I think that's a good description of Czech
Yeah.
people. Uh,
So now
and
you
one
are
sorry,
sorry,
one
yes.
tip for Czech people, they may look cold from outside, but I realize that they are just shy people because when you approach them after some time they will just open up and be very friendly with you.
Yeah, from my experience, you just need to crack the shell. It doesn't
Yes,
take a lot of
exactly.
time, and they are fantastic.
Exactly.
And so now, after graduation, what are your plans for the future? You're going to practice at home or somewhere else?
No, I'm moving to Netherlands.
Ah, fantastic.
Yeah,
Where?
I haven't decided the city, but my brother, part of my family, is living there. So I'm just gonna start my life there. I'm trying to learn the language,
Good
and
luck.
then thank you so much, and then apply jobs, and because I need registration first to
Mhm.
able to practice medicine.
And you think about neurosurgery?
Yes, yes, neurosurgery, neurology,
You
definitely.
know what is the difference between neurosurgeon and God?
I remember we talked this, but I forget it.
God does not think that he's a neurosurgeon.
I'm glad that I met with good neurosurgeons.
Yeah. Looking back, what do you think that Ostrava offered you as a faculty, as a city, as a whole package, all the experience, the Ostrava experience?
I always say Ostrava is my home now because I spend a lot of time here and it's not too crowded, it's not too big. So you don't get lost in the city. You don't feel like you are in a big city and you are lost because it's not. It's more calmer, so it doesn't give you a feeling of rush. You can be like on time. You can also relax and chill. It's not very big, so you are not confused. It's very easy to adapt. And also less distractions, more motivations to study. So, yeah, and for the faculty, especially like I really like the clinical part of it because we are not very big groups, we had a lot of opportunities to be hands-on, like to contact with people, to be with people, to try something. And because also we are very small, like we had chance to ask whatever we want in the classes as well. Sometimes it even felt like private lectures.
During the weekends or vacations, did you travel somewhere from Ostrava?
Yes, definitely. That was my biggest motivation during studies. I traveled almost all the neighbor countries. I traveled UK a lot because from Ostrava, like there's the direct flight to London, and it was really cheap, so
Yeah.
you can use that too. I traveled all like Poland through Czech Republic. I think if you can manage your studying, you can even travel every month, but it really depends on you, your studying, your budget, and everything else.
Yeah, actually, in very short distance, you have Krakow, Vienna, Prague.
Yeah, and also I really like the train system here. Public transport is really good. Like no delays, really fair amounts of money, so it's really easy to travel.
Yeah, definitely. The Czech transportation system, buses and trains, is well known for its efficiency, comfortable, and reasonable prices.
Yeah.
Okay, so if we want to sum up in a sentence or a tweet for the potential students, young men and women that are considering to study, can you give them a phrase about Ostrava?
That's a good question. I think Ostrava is like a closed box that they need to discover because it may seem like it's small and not a lot of things are there, but when you discover, will be a lot of things to do here. So they need to discuss, stay calm, be happy, and discover it.
Yeah. Okay, that was good. Okay. So, Sylvia, thank you very much for this lovely conversation and for your time. And I wish you all the best in your future career.
Thank you so much for your time as well.
Bye bye.
Thank you. Bye.